I need to tell you something that's been eating at me for years, and I know the moment I say it out loud, some of my colleagues are going to be pretty upset with me. But after more than 2 decades in medicine, after watching what happens to people when they follow every single recommendation that comes their way, I can't keep quiet anymore. I'm Dr. Richard, and here's the thing nobody wants to admit. Sometimes the worst thing you can do for your health is get too many tests, especially after you cross 60 or 65. I can already hear some of you thinking, wait a minute, isn't this doctor supposed to be telling me to get checked for everything? Isn't prevention supposed to be the whole point? Yes, that's exactly what we've all been told. Catch it early, find it before it becomes a problem, stay on top of everything. That's the message we hear from every wellness ad and every health brochure. But what if I told you that message is leaving out the most important part of the story? The part about what happens after you find something. Once you find something, anything at all, even something that would never have hurt you, the wheels start turning, and sometimes those wheels run right over the life you were quietly enjoying. Today I'm going to walk you through 4 medical tests that I have watched cause more problems than they solve, particularly for people over 60. I am not telling you to refuse any screening, I am telling you to understand exactly what you're signing up for before you say yes. Before we go further, drop a comment and tell me your age and whether you have ever felt pushed into a medical test that didn't feel right. I read every comment, and your responses shape what I cover in the next videos. We're counting down from 4 to 1, the most important one is last. The cascade effect, the framework that changed my practice. Before the specific tests, you need to understand one thing that completely reorganized how I practice. We call it the cascade effect. Once you see it, you cannot unsee it. Here's how it works. You go in for a screening test. You feel perfectly fine. The test comes back showing something. Maybe a spot, maybe a shadow, maybe a number that's slightly off, that something might be completely harmless. It might have been sitting there for 20 years and might sit there for 20 more without ever bothering you. But here's the problem, the doctor sees it, and now they have to do something about it, because what if they don't, and what if it turns out to be serious? So they send you to a specialist. The specialist orders a more detailed test. That test shows the same thing, still not clear. Now you're talking about a biopsy, a procedure, or maybe even surgery. Each step has risks, infection, bleeding, complications, lost time, weeks of anxiety, and the kicker, when you get to the end of all that, the overwhelming majority of the time, you find out it was nothing. It was never going to hurt you, but now you have been through months of worry, you have had procedures, maybe you have had complications, you're worse off than when you started, all because of a test you got when you felt fine. That is the cascade. It starts with one test you may never have needed. Number 4, whole body CT and MRI scans. This one is tricky because it sounds so smart, so modern, so preventive. Whole body scans, full body MRIs or CT scans that promise to check everything at once. You have probably seen the ads. Come in. We'll scan you head to toe, catch anything before it becomes a problem. Sounds amazing, I get it. The idea of knowing everything, of having control, that's incredibly appealing. But here's what actually happens in practice. You're 65, you feel great, you're active, no symptoms of anything. You decide to get one of these scans just to be safe. You lie in the machine for 30 minutes. A couple days later you get your results. And right there in the report, the radiologist mentions something, a small nodule in your lung, 3 millimeters, the size of a pencil eraser, or a cyst in your kidney, or a spot on your liver. The report says recommend follow-up imaging in 3 to 6 months. Now how do you feel? You went in feeling healthy, and came out being told there's something in your body that needs watching. Every time you take a deep breath, you wonder about that lung nodule. Every time you feel anything in your side, you think about that kidney cyst. 3 months later, you go back for another scan. Maybe the thing is still there, maybe it's a tiny bit bigger, hard to say. The radiologist recommends seeing a specialist. The specialist recommends a biopsy. A biopsy isn't nothing. Anesthesia, a needle into your lung, or your kidney, or your liver. Risk of infection, bleeding, or collapsed lung. Here is what the research shows. Davenport's review in the American Journal of Roentgenology estimated that roughly 20 to 40% of CT examinations contain at least one incidental finding. Furtado and colleagues, in a 2005 whole-body CT screening series published in Radiology, reported that findings appear in roughly 86% of asymptomatic adults, with the vast majority being benign by description. The vast majority of these findings, spots, cysts, shadows, will never cause a problem. They are part of having a body around for 6 or 7 decades, like wrinkles on the inside, but once we find them, we cannot ignore them. That is when the cascade starts. And here's what should genuinely concern you. People who get whole-body CT and MRI scans have not been shown in the rigorous comparative literature to live longer than people who don't. They don't avoid more diseases, but they do experience significantly higher rates of anxiety, repeat imaging, and unnecessary invasive procedures. The scan makes them feel sicker, not healthier. So what should you do instead? Pay attention to how your body actually works. Can you walk up 2 flights of stairs without getting winded? Can you rise from a chair without using your hands? How's your balance? How's your sleep? These functional measures tell us far more about your actual health than any scan. If you want a real health checkup, sit down with a doctor who will spend time with you. Someone who goes through every medication you're taking, because I guarantee at least one of them is doing more harm than good. Someone who talks to you about your diet, your activity, your social connections, the boring everyday things that determine how healthy you actually are. The scan looks for problems that may not exist. The functional assessment optimizes the health you already have. Big difference. Now, if you have specific symptoms, unexplained weight loss, persistent pain, a palpable lump, blood where blood shouldn't be, those warrant targeted imaging. We're not talking about that. We're talking about the asymptomatic full-body scan marketed to a healthy 65-year-old. Number 3. Brain MRI for everyday forgetfulness. This one affects a lot of people because it touches the fear most of us carry about aging. You're in your mid-70s, you can't remember the name of an actor, you walked into the kitchen and forgot why. Your kids are worried. They push you to get a brain scan. I understand that fear. Nobody wants to think about losing their memory, losing themselves. But here's what I need you to understand. Getting a brain MRI for mild forgetfulness is almost never helpful and is often harmful. Here's what happens. You get the MRI. A few days later you're sitting with your doctor reading the report. The report says mild cerebral atrophy, age-related changes, white matter lesions, small vessel disease. Those words sound terrifying, like your brain is deteriorating. But here's the truth. Those findings are completely normal for someone in their 70s. They describe what almost every brain looks like at that age. It's like doing a scan of your skin and being shocked that it shows wrinkles and age spots. Of course it does. That's what skin looks like at 75. The problem is those medical terms don't sound normal, they sound like disease. Suddenly you're walking around thinking you have brain damage, that Alzheimer's is right around the corner, even though you're functioning fine. Studies examining age-related brain MRI changes in older adults have repeatedly shown that the abnormalities the reports flag, small white matter hyperintensities, mild cortical thinning, periventricular signal changes, appear in the overwhelming majority of cognitively normal older adults. I have seen people who are sharp, managing their finances, reading every morning, whose MRI looks terrible. I have also seen people with real early dementia whose MRI looks pretty unremarkable. The picture doesn't tell us what we wish it told us. So, what should you do instead? If you're worried about memory, there's a much better way to check. Simple cognitive tests we can do in the office, about 10 minutes. We ask you to remember 3 words, draw a clock showing a specific time, count backward from 100 by sevens. Simple tasks that measure how your brain is functioning, not just how it looks. And if those tests show a real problem, we start looking for causes. Most causes of memory problems in older adults are reversible. A medication making you foggy, low B12, depression, which often shows up as memory trouble in older adults, sleep apnea quietly cutting off oxygen to your brain at night, a thyroid problem. We check all of those first. You'd be amazed how often fixing one brings the memory right back. No MRI needed. If someone is getting progressively worse, getting lost in familiar places, unable to manage money, that's different. Those are real red flags. A full workup including imaging makes sense, but for everyday forgetfulness that comes with age, an MRI creates more problems than it solves. Number 2. Preoperative treadmill stress tests by default. This one surprises people because it seems so logical. Putting someone on a treadmill before surgery, just to be safe. But the logic falls apart on inspection more often than people realize. A typical situation, you're 72. You're going in for routine surgery. Nothing major, maybe a hernia repair, maybe a knee replacement. The hospital protocol says everyone over 70 needs a cardiac stress test before surgery. So even though you feel fine, even though you can walk a couple of miles without chest pain or shortness of breath, they put you on a treadmill. Now think about this for a second. If you can walk 2 miles in your daily life without any problem, what exactly is the treadmill going to tell us that we don't already know? Your daily life is your stress test. You're already passing it every single day. A 2018 review by Pays and colleagues in the Indian Heart Journal made this point directly. In asymptomatic persons with few cardiovascular risk factors, the likelihood of a false positive on routine exercise treadmill testing is high, and the downstream effect is downstream expensive cascades of additional testing. Fitzgerald's 2019 work in the heart, lung, and circulation literature on female exercise ECG testing documents test accuracy around 60%, meaning a meaningful fraction of abnormal results in asymptomatic people are not actually abnormal at all. But protocol is protocol. So you get on the treadmill. Stress tests have a high rate of false positives in older adults. Could be because your heart rate doesn't respond the way it used to, could be because of medications you're on, could be 100 reasons that have nothing to do with a dangerous blockage. Once that test comes back as abnormal, the medical conveyor belt engages. They schedule you for a cardiac catheterization. That's the procedure where they thread a tube through an artery to your heart. Invasive, real risks. Often, when they get in there, they find exactly what you'd expect in a 72-year-old heart. Some plaque buildup, some mild narrowing, nothing that requires a stent, nothing that was about to cause a heart attack, but now you've been through an invasive procedure. Worse, you've been labeled a heart patient. New medications, the psychological damage is done. Maybe you were playing tennis before, but now you're afraid to exert yourself. The test that was supposed to protect you has stolen your confidence and your activities. So what is the alternative? Listen to your body. If you can climb stairs briskly, if you can walk at a good pace, if you can do your daily activities without chest discomfort or unusual shortness of breath, you're telling us, through your actual life, that your heart is doing its job. Those are the symptoms to watch for. Chest discomfort with exertion, unusual shortness of breath, dizziness that doesn't resolve. If you have those, yes, absolutely get checked. But if you want to know your future risk without a treadmill, there's a better tool. The coronary artery calcium score, a low radiation CT scan, 5 minutes, no treadmill, no needles. It measures the calcium sitting in the coronary arteries. The result is a number. 0 means a very low risk of a heart attack in the next several years, validated in the 2019 ACT/AHA primary prevention guideline work and reaffirmed in subsequent lipid association guidance. A high number means you need prevention with diet, exercise, and possibly medication. The calcium score tells you your risk, it guides prevention, it doesn't automatically send you into procedures, it gives you information so you can choose, not anxiety that pushes you into procedures. Don't let someone put you on a treadmill just because of your age. Trust what your body is already telling you. Number 1. Routine colonoscopies into your 80s. We've reached the most important one. I know this one will be controversial. I'm talking about routine screening colonoscopies when your previous ones have been normal, when you don't have family risk factors. I need to be very clear. I am not against colonoscopies, they're a fantastic tool. I recommend them starting at age 45, in line with the United States Preventive Services Task Force, which now endorses routine colorectal screening from 45 through 75. If you're in your 50s, 60s, or early 70s and do, please get it done. They prevent colon cancer by letting us remove polyps before they turn into cancer. But here's the thing I want you to consider. Every medical test balances benefit and risk, and that balance changes as we get older. The benefit of a colonoscopy is preventing a cancer that takes years, often many years, to develop into a problem. But if you're 78 or 80, is that benefit still worth the procedural risks? Because colonoscopies do have risks, and those risks go up with age. There's the preparation, drinking that awful liquid that keeps you in the bathroom all night. In an older adult, that can leave you dehydrated, weak, and vulnerable to a fall. There's the sedation, which in older adults carries greater risk of confusion, delirium, or breathing complications. And there's the big one we worry about most, perforation, a tear in the wall of the colon. As we age, the colon wall gets thinner. The risk that the scope accidentally tears through it goes up. The 2004 Bowles UK colonoscopy practice audit published in Gut documented perforation rates across the practice spectrum. The 2022 American College of Gastroenterology Guideline Summary in American Family Physician was explicit. Older patients have higher adverse event risks, including perforation during colonoscopy, along with higher rates of false positive findings and procedural cardiovascular events. A perforation is a surgical emergency, often emergency surgery, sometimes a colostomy bag. For an 80-year-old, that kind of operation can be the end of independent living. Now weigh that against the benefit. You're trying to prevent a cancer that would take years to develop. If your life expectancy is less than 10 years, the math starts to favor leaving things alone. That's why the USPSTF recommendation stops at 75 for routine screening, with the 76 to 85 range framed as an individualized decision. The 2021 update in JAMA was unambiguous. Routine screening for adults 76 to 85 should be an individualized choice, weighing the patient's overall health and prior screening history. The Multi-Society Task Force on Colorectal Cancer Guidance goes in the same direction. Now, this is not a one-size-fits-all thing. If you have a strong family history of colon cancer, if you've had polyps removed before, if you have inflammatory bowel disease, that's a different calculation. Your gastroenterologist should be making that call with you. But for the average person with no special risk, continuing colonoscopies every 5 or 10 years into your 80s is probably doing more harm than good.
Mom.
So what do you do instead? Do you just ignore your colon? Absolutely not. You shift from invasive screening to smart surveillance. First, pay attention to symptoms. This is crucial. Persistent unexplained changes in your bowel habits, blood in your stool, unexplained abdominal pain or weight loss, anemia that comes out of nowhere. Those are red flags. At that point, age doesn't matter. You need a colonoscopy to figure out what's going on. Second, use the power of diet. The single best thing you can do for your colon at any age is eat fiber. Fruits, vegetables, beans, whole grains. Fiber feeds the good bacteria in your gut, and those bacteria produce compounds that protect against inflammation. More lentils, more broccoli, more oatmeal, more apples, prevention that helps your entire body with zero procedural risk. The message is simple. Get your colonoscopies when they make sense, through your early 70s. After that, for most people, focus on symptom awareness and a fiber-rich diet. Do you see the pattern? It's the same every time. A test finds something, that triggers another test, that triggers a procedure, that triggers a complication, and somewhere along the way, we forget to ask the most important question: is this person actually better off? Because here's what I've learned in 22 years of medicine. Health isn't about having perfect test results. Health is about function, being able to do the things you want to do, enjoying your grandkids, taking walks, reading books, living your life without fear and without unnecessary medical interference. The goal at 65 or 70 or 80 isn't just to live longer, it's to live better, with independence, with dignity, with joy. And sometimes the best way to protect that is to ask hard questions before you say yes to a test that sends you down a rabbit hole you don't need to go down. How to be a shared decision-making patient. None of what I've said should be read as advice to refuse screening. Read it as advice to participate more actively. When your doctor recommends a test, here are 4 questions worth asking. 1. Why is this test being recommended for me specifically? Is it because of a symptom, a risk factor, an age-based protocol, or a habit? Age-based protocols are guidelines, not orders. Symptoms are different. 2. What happens if we find something? Not what could be there. What is the actual clinical pathway after a positive result? What further tests? What procedures? 3. What are the specific risks of the test itself, in someone my age, with my health profile? Risks change with age. The honest answer matters more than a generic, it's very safe. Inverprofile. 4. Is there an equally good alternative with less downstream cascade risk? Function tests instead of imaging. Symptom-based screening instead of routine. Targeted imaging instead of whole body. If your doctor won't answer those 4 questions clearly, that is itself a useful piece of information. A short, honest final note. I am not your doctor. Your specific risks depend on medical history, family history, medications, and conditions I don't know about. This is a framework for thinking, not a prescription for action. If any of the symptoms I described apply to you right now, chest pain, blood where it shouldn't be, persistent bowel habit change, progressive memory loss, unintentional weight loss, please bring that to a clinician. Targeted workup for actual symptoms isn't the same as routine screening for healthy people, and it matters most when there's something going on. Loss. If this made you think differently about medical testing, share it with someone who might benefit. Subscribe if you want more honest conversations about health and medicine. I'm going to keep having these conversations because I think they matter. Drop your age and your experience in the comments. Have you ever been pushed into a medical test that didn't feel right? I read every comment and I learned from your experiences, just like you learned from mine. Take care of yourselves. Remember, sometimes the healthiest thing you can do is ask one more question before you sign the consent form. I'll see you in the next one.